Hi there, welcome to week number 11 in medical terminology, and we'll be going over chapter 13 in your book, The Blood System, and this starts on page 504. But before we get started, I'd like you to raise your hand if you'd like an A in this class. How about a B? Oh, a few more hands. How about an A, B, or an O? Well, those aren't grades, those are blood types, and we're going to be talking about those today. So first of all, on page 504, the introduction talks about the responsibilities of blood, or what blood does. It maintains a constant environment for the other living tissues of the body. It transports food, gases, and waste to and from the cells, removes the waste products released by the cells, also transports chemical messengers, also known as hormones, and contains white blood cells and proteins that help fight infection, as well as platelets that help your blood to clot. What is blood made of, or what is the composition and formation of blood? Well, it's made of cells, and these are formed elements, or the solid things, and these are all suspended in a straw-colored liquid known as plasma. And plasma makes up 55%, so a little bit over half of the volume of blood. The other 45% is constituted by red cells or erythrocytes, white cells or leukocytes, and platelets or thrombocytes, which are the clotting cells. So 55% is the plasma, and 45% is your cells. Beginning at birth, all of the blood cells originate in the bone marrow, or the middle of the bone, the medullary cavity in the bone, and we'll talk about that when we get to that chapter. And all blood cells originate from the hematopoietic stem cells. And under the influence of proteins in the bloodstream and the bone marrow, these stem cells can change into anything, any type of cell your body needs. They can change their size and shape to become specialized or differentiated, depending on what's needed at the time. And that's why stem cells are so precious, because we can take stem cell from a newborn baby, and we get that from the cord blood. We can get some of those stem cells, and it can be life-saving for many diseases for the baby and for baby's immediate family. The first cells we're going to talk about are the erythrocytes, and I'll be referring to the picture on page 505, which is a nice picture of the progression of the formation of blood cells from the hematopoietic stem cells all the way up to circulating in the bloodstream. The erythrocytes are first, and they're all the way over on the left as you're looking at that diagram. They start off in the hematopoietic stem cell, as do all of the other cells. And in the bone marrow, they grow from an erythroblast, where if we break that word down, blast means immature, so immature red cell. And then it turns into a normal blast on its way to becoming a red blood cell. When it gets into the bloodstream, when it's very young and not functioning yet, it's a reticulocyte. And then at the bottom, it is a erythrocyte. And if you look at that cell, it has a very distinct shape to it. It loses its nucleus, and it assumes the shape of a biconcave disc. This shape allows for a larger surface area, so the absorption and releases of gas, which include oxygen and carbon dioxide, can occur. And red cells contain hemoglobin, This enables the erythrocyte to carry oxygen. Without hemoglobin molecules on the red blood cell, it would not be able to carry oxygen. And the combination of oxygen and hemoglobin, or oxyhemoglobin, gives the blood its bright red color. Erythrocytes originate, like we said, in the bone marrow. Erythropoietin from our kidneys stimulate their production. They live and fulfill their role of transporting gases for about 4 months or 120 days in the bloodstream. After that 120 days is up, macrophages in the spleen, liver, and bone marrow destroy the tired, worn-out erythrocytes, and your body is making more constantly and replacing the tired ones with new, fresh ones. 2 to 10 million cells are destroyed each second. And because they're constantly replaced, the number of circulating red cells remains constant at about 4 to 6 million. So right now you have anywhere between 4 and 6 million red blood cells circulating in your bloodstream, and every second 2 to 10 million are being destroyed while they're being manufactured and put in the bloodstream to maintain that 4 to 6 million constant. As macrophages break down erythrocytes and the hemoglobin within, the heme releases iron and decomposes into a yellow-orange pigment called bilirubin. The iron in the hemoglobin is reused to form new red cells, or if it's not needed, it's then stored in the spleen, liver, or bone marrow for future use. Bilirubin is excreted into the bile by the liver and enters the small intestine, where it is then excreted in the stool. So those are red blood cells or erythrocytes. The next types of cells, we're going to go to the middle of that diagram, and we're going to look at the white cells or the leukocytes. We have many less white blood cells circulating than red blood cells. So there's fewer of them, but there are different types of white blood cells in the blood. We have 5 different types of white cells at any given time. We have polymorphonuclear granulocytic cells and mononuclear agranulocytic cells. The polymorphonuclear granulocytic is a cell that has granules in the cytoplasm, and the polymorphonuclear part of that means it is a cell that has a multi-lobed shaped nucleus. The 3 different kinds of polymorphonuclear granulocytes are basophils, neutrophils, and eosinophils. And if you look in the picture there, in the bone marrow, these all come from that hematopoietic stem cell, turning into a myeloblast, turning into myelocytes when they're still in the bone marrow. And these granulocytes, once they get in the bloodstream, are known as band cells. And when they're fully mature, they are known as basophil on the left, which has 2 lobes, neutrophils in the middle, which has 3 lobes, and eosinophil on the right, which has 2 lobes as well. But what sets them apart from the others is the color of their granulocytes, or the granules in the cytoplasm. The first one is the basophil, and that's on the left. And if you look at the granules in the cytoplasm, they stain dark, and they stain dark with a basic or alkaline dye. Granules contain heparin, or an anti-clotting substance, and histamine, which is a chemical that's released in allergic responses. Eosinophils are over on the right. And if you look at their granules, they stain with eosin, which is a red acidic dye. Eosinophils increase an allergic reaction. Eosinophils will come up and engulf the substance that trigger the allergen, whether it be environmental or food. And the neutrophils are in the middle. The neutrophils, if you look real close, you can see the granules, but they're not very distinct because their granules are neutral. They don't stain really strong with either the acidic, which would be red, or the basic, which would be a blue or purple dye. These are phagocytes that accumulate at sites of infection, where they ingest and destroy bacteria. These are the most numerous of the granulocytes. And if you turn your book ahead a couple of pages to page 508, it breaks down the percentage of these granulocytes for us. The basophils are only 0 to 1%, and those are the ones that respond to allergens, histamine, and heparin. So they're very rare. Eosinophils are 1 to 4%. And again, parasitic infections and is a phagocyte and allergic reactions. And the neutrophils, if you look at that percentage, 50 to 70. So it's a big chunk of our white blood cell count comes from the neutrophils. And these are the ones that have the major role in fighting bacterial infection, and these are the phagocytes. So these are the 3 granulocytes. The mononuclear agranulocyte cells, if you look on page 505, they're pictured. They do not have a large number of granules in their cytoplasm. They may have a few, but nothing like the granulocytes. They start off in the bone marrow, again, as a hematopoietic stem cell, changing to the mono and lymphoblast, where they then, when they get in the bloodstream, become the monocyte and the lymphocyte. And it is not a multi-lobe nucleus, it's just a big nucleus, and very few granules, if any. So we're going to look at the lymphocyte first, and that's the one over on the right. Lymphocytes are made in the lymph nodes and circulate both in the bloodstream and in the parallel circulating system, the lymphatic system. Lymphocytes play an important role in the immune response that protects the body against infection. They can either directly attack the foreign matter, the virus, or the bacteria, or whatever the pathogen may be. But the lymphocytes have a very important job. They're the ones that make antibodies, and those neutralize and can lead to the destruction of foreign antigens, and more importantly, antibodies lead to immunity upon further exposure. So when you get your flu shot this fall, your lymphocytes will stand up and say, oh, that looks like something new. I better make antibodies towards this pathogen. So if in any case in the future during this flu season you're exposed to influenza, your body will know how to fight the infection, and that's thanks to the lymphocytes. The monocytes over on the left, they are phagocytic cells, which means they eat other cells. They also fight disease. They move from the bloodstream into the tissue as macrophages, or big cells, and dispose of dead and dying cells as well as other debris by phagocytosis. I always think of the monocytes as the vacuum cleaner that goes and cleans everything up before, during, and especially after an infection. If you flip ahead again to 508, you can see the mononuclear cells percentage-wise is given for us. The lymphocytes are the second in line for the most numerous, for the total white cells, 20 to 40%. And these are the ones, remember, that make the antibodies. And the monocytes are few as well. They're 3 to 8%. And these are the ones that I think of as kind of the vacuum cleaners that go and get rid of all the debris after the infection or the exposure has taken place. So we have the erythroblasts, or red cells, and the 5 types of white cells. Okay, 3 granulocytes, 2 agranulocytes. The platelet is over right next to the erythrocyte on page 505. The platelet is also known as thrombocytes, and these are formed in the red bone marrow, and they're formed from giant cells with a multi-lobed nuclei called megakaryocyte. And if you look at the picture in the bone marrow, this hematopoietic stem cell grows or becomes a megakaryoblast into a megakaryocyte, which has the tiny and numerous lobes of the nuclei. And once it gets into the bloodstream, between the bone marrow and the bloodstream, tiny fragments of this megakaryocyte break off to form platelets. And I always think of it as the megakaryocyte is a chunk of cheese, and you're grating it by hand on a cheese grater, and what falls off after you grate it are these platelets, or thrombocytes. And the main function of platelets or thrombocytes is to help the blood to clot. Okay, so erythrocyte is responsible for oxygen delivery and carbon dioxide pickup. White cells, no matter which kind they are involved in some sort of infection prevention, and platelets are there to help the blood to clot. All of these are life-saving and necessary elements of the blood. And plasma. I said that 55% of the blood is plasma, and that's the liquid part of the blood. Normally straw-colored. When somebody's healthy, it can get cloudy when there's an infection. Consists of water, dissolved protein, sugar, waste, salts, hormones, and other substances. There are 4 major plasma proteins. We have albumin, globulins, fibrinogen, and prothrombin, which are also clotting proteins that help work with thrombocytes to help the blood to clot. Albumin maintains proper proportion and concentration of water in the blood. Albumin or protein cannot pass easily through capillary walls, remains in the blood and carries smaller molecules bound to its surface. It attacks water back from the tissue into the bloodstream, and it opposes the water's tendency to leave the blood and leak out into tissue spaces. So the albumin is what keeps the blood hydrated or at that perfect ratio of liquid to solid or cells. Globulins. We have alpha, beta, and gamma globulins. These are all types of immunoglobulins. The gamma globulins specifically are antibodies that bind to and sometimes destroy antigens. And antigens are the pathogens. Immunoglobulins are separated from other plasma proteins by electrophoresis, where we carry the immunoglobulins away from the plasma and keep them maybe for transplant to other patients. And examples of immunoglobulin antibodies that are found in the plasma are IgG, and this is found in high concentration in the plasma, probably the highest of all of them. IgA, IgM, IgD, and IgE. Plasmapheresis is a process of separating plasma from cells and then removing the plasma from the patient. And if we look on page 13 or 509, figure 13.7, this is a composition of blood and everything we just talked about. The cells, which is 45% of the blood, plasma is 55%, and they have the picture and the labels of the different blood types. And the leukocytes, they have all 5 different. They list the granulocytes first and the agranulocytes second. What's in plasma, and then water, salts, nutrients, hormones, fats, and vitamins. And then the proteins, they go on to fully break down into albumin, globulins, fibrinogen, and prothrombin. Remember, albumin is a protein. Globulins has alpha, beta, and gamma. These are present in the blood all the time. The gamma globulins are the most numerous, and these are the immunoglobulins or the antibodies. And the fibrinogen and the prothrombin are what help the thrombocytes to help blood to clot during times of injury or bleeding. Blood groups. Remember when I asked you, do you want an A, do you want a B? Do you want an A, B, or an O? I was talking about different blood groups. And our blood is typed or put into 4 different categories. Transfusions of whole blood are used to replace blood loss after injury or during surgery when a lot of blood is lost, or when somebody's in severe shock and has lost a lot of blood and needs their volume of blood replaced. For someone who is severely anemic and needs only red blood cells because their iron and or hemoglobin is low, they will receive a transfusion of packed red cells only. They do not need the plasma. So they'll do whole blood with most of the plasma removed so they get the erythrocytes that they need. If you look on page 510, they have the blood types listed along with the percentage of people in our society with that blood type. Type A represents 41% of the population. Type B represents 10%. Type AB, which is kind of rare, is only 4%. And type O is 45%. Harmful effects of transfusing blood from one group to another. It has to be compatible. And we'll talk about compatibility, and I have a website to send you to look at this as well. Before blood is transfused, the donor and the recipient are tested to be certain that the transfused blood will be compatible. And then before it's actually transfused into the patient, there is at least, if not more, 3 different people that have to check to make sure compatibility is obtained. Each of the blood groups, A, B, AB, and O, has a specific combination of factors called antigens and antibodies. Each blood group antigens are inherited, and antibodies are acquired by about 6 months of age after exposure to specific antigens. If we look at type A, and we'll just go down the A, B, and O, we'll go in that order. Type A contains A antigen and anti-B antibody, which means it likes A blood and it will fight B blood. By fighting, I mean it will destroy it. Type B contains B antigen, so it likes B blood. And it also has anti-A antibody. It will fight type A blood. Type AB, which is the one that's rare, only about 4%, contains A and B antigens. So it likes A and it likes B. And it has no anti-A or anti-B antibodies. Type B likes everybody. I'm sorry, type AB, likes everybody. There are no antibodies. Type O is containing no A or B antigens and both anti-A and anti-B antibodies. So O does not like A and O does not like B. So what does this mean? Well, this means that only certain blood groups can donate to other blood groups. If you are type O, let's talk first about this. When transfusing a type A donor, I have type A blood, and let's say Chris has type B blood, and I think she does actually. So if I were to donate blood to Chris, I'm type A, she types B. The antigens, the A antigens in her blood will react adversely with the anti-A antibodies in my blood. So her blood will fight my blood. It doesn't like A. And my blood, A, doesn't like B. So this can lead to death. So this accidental adverse reaction, the term for that is hemolysis. Lysis means to break down or destroy, and hemo means blood. What can happen is within minutes after starting the transfusion, if hemolysis takes place, intravascular hemolysis may lead to what we know as DIC, or disseminated intravascular coagulation, which, to put it in simple terms, is the blood just clots in the vessels and stops flowing through the system. So the blood clots and stops, and that will lead to death. If caught really quickly, we can stop the transfusion and reverse those effects. One of the first things the body will do when there is an adverse reaction to a blood transfusion is they will spike a temperature really, really fast. Like they will go from maybe no fever or a real low-grade fever up to 104 or 105 really, really quickly. Okay, nurses who do blood transfusions, and this happens all the time, they say 1 in 4 people in their lifetime will need a blood transfusion at some time. So it happens often. And the nurse, when they start a transfusion, they usually stay by the patient for the first 15 minutes or so at least to keep an eye on them, monitor their vitals, that type of thing. So we don't transfuse with groups that aren't compatible. But some groups are compatible with all, and some groups are compatible with none, and some groups are picky and just want certain ones. If you have type O blood, and that's the most common, about 45% of people have O blood, you are known as universal donors. Yay. You are what the Red Cross or the Mississippi Blood Valley chapter blood donation calls you probably when they're in the area or when they have a need, because you can give to anybody. Your blood contains neither A nor B antigens. And the anti-A and anti-B antibodies in O blood do not have an effect in the recipient because the antibodies are diluted in the recipient's bloodstream. Not having the antigens is what makes you a universal donor. You can give to anybody. Type AB blood, but you can only receive from O. O blood can give to anybody, but it can only receive from O blood. Type AB blood are the universal recipients. They like everybody. They contain neither anti-A nor anti-B antibodies, so neither the A nor the B group antigen will cause hemolysis in their blood. They can receive from anybody. So O are the universal donors. AB are the universal recipients. As far as O blood go, when we talk about the RH factor is that positive or negative that goes after your blood type. I'm A positive. You may be AB negative or B positive or B negative. O negative is the most true universal donor. You can go to anybody. Only 7% of those with O negative blood, with type O blood, are O negative. So 45% of the population has O blood. Only 7% of that 45% is O negative. So those people, and maybe you're one of them, if you're type O negative, you'll probably get birthday cards from the Red Cross. They treat you very well. Not that they don't treat anybody well, but your blood is the most desirable. In an emergency room, the most common and the most plentiful blood that we have on hand is always O negative. Because if we need blood now in an emergency situation, we're going to grab O negative because we know it's compatible for anybody. The RH factor, let's talk a little bit about that. It's got its name because it was first found on the blood of a rhesus monkey, and RH is the first part of the word rhesus. RH positive refers to a person who is born with the RH antigen on his or her red blood cells. And RH negative does not have the RH antigen. If RH positive blood is transfused into RH negative, the recipient may, but not always, begin to develop antibodies that would cause hemolysis of RH positive blood if another transfusion were to occur in the future. Blood clotting, also known as coagulation. This is a complicated process involving many different substances and chemical reactions within the blood. The final result within 15 minutes is the formation of a fibrin clot from the plasma protein fibrinogen. And platelets are also important along with fibrinogen in beginning the process following injury to tissues or blood vessels. The platelets, let's say somebody gets their blood drawn, so that needle enters the tissue on the arm or the hand, goes into the vein and cuts into the vein. As soon as that happens, the platelets clump and aggregate or gather together at the site of injury, and then a protein tissue factor, other clotting factors, and calcium promote the formation of a fibrin clot. And this happens right away. One of the clotting factors is clotting factor 8, which is missing in some people who are born with hemophilia. Other hemophiliacs are missing clotting factor 9. So if we look on page 511, it has a sequence in the events of blood clotting and the chemicals and substances involved. The injured blood vessel, so either patient got injured, maybe they cut themselves doing dishes and they cut their hand, or they're in the lab and they're having phlebotomy done. As soon as that happens, platelets gather around the site in combination with tissue and protein clotting factors, calcium, vitamin K, prothrombin, and thrombin, change into fibrinogen to form a fibrin clot within minutes. How can we help this along? We usually can apply pressure to the site. Pressure helps that clot to form even a little faster. The fibrin threads form the clot by trapping red blood cells and platelets in plasma. And the clot then retracts into a tight ball, leaving a clear fluid called serum. Normally, clots do not form in blood vessels unless the vessel is damaged or the flow of blood is impeded. And anticoagulant substances in the bloodstream inhibit blood clotting, so thrombi and emboli do not form. A thrombi is a clot, and an emboli is when the clot moves from one area of the body to another. Heparin is produced by the tissues, especially the liver, is a natural or a body-made anticoagulant. We also have other coagulants that come in the form of drugs called warfarin, which that's a generic for the trade name Coumadin. And these are given to patients with thromboembolic disease to prevent the formation of clots and emboli, or traveling clots. The picture on the bottom of 511 are red blood cells enmeshed in the threads of fibrin as a clot is formed. So we said that O was a universal donor. So O can give to anybody. A can donate to A and AB, and that's it. B can donate to B and AB. And AB can only donate to AB. I'm going to send you to a website, and you'll see this on the website, and it's a really nice rendition or representation of who can donate to who as far as blood types. Okay? So let's look at some combining form suffixes starting on page 514. If you look on 514, our first combining form is baso, and that means base or alkaline. Basophil, the suffix phil means attraction to, and basophil describes a cell that has an attraction to a basic dye or an alkaline dye. Chromo means color, and I think we've had that one before. Chromo is color. So hypochromic would be pertaining to decreased or low levels of color. Coagulo means clotting. Anticoagulant is a substance that fights clotting. Coagulopathy is a disease of the clotting cells, or a clotting disease. Cyto we've already had, it means cell. Cytology, we've had that term already also, it means a study of cells. Eosino is a new one. It means red dawn, or rosy. And eosinophil is something that's attracted to red, dawn, or rosy, and that's a color. And that's a color that comes from the acidic dyes. We've had erythro, it means red. Erythroblast means immature red cell. Granulo is a new one, but it means granules. Granulocyte is a cell with granules. We've had hemo and hemato. They both mean blood. Hemolysis is the breakdown or destruction of blood. And hematocrit. The suffix crit means to separate. Excuse me. Hematocrit is a separation of blood. We do a hematocrit to get the percentage of red blood cells in a sample. Hemoglobino means hemoglobin. Hemoglobinopathy would be a disease of the hemoglobin. Iso means same or equal. Anisocytosis. Osis means abnormal. AN is a prefix that means no, none, or without. Iso means equal, and cyto is cell. So anisocytosis would be an abnormal condition of unequal cells, where the cells aren't the same size or shape. And it's actually an abnormality of red blood cells. Some are big and some are small with anisocytosis. Karyo, we've had that for nucleus. Megakaryocyte is a cell with a large nucleus, and that's a precursor to platelets. We've had leuco for white. Leukopenia means deficiency of white cells. We've had mono for one or single. A monocyte is a cell with one nucleus. And we've had morpho for shape or form. So a morphology is the study of shape or form. So quite a few of these we've had in the past. And if you know that leuco is white and you know that karyo means nucleus, you don't have to make a new card for those. You could either pull the cards from previous chapters and review them before the test, but if you already know them or it's already in your brain, then don't reinvent the wheel and make a new card. That's okay. Myelo in this context means bone marrow. Myelo in the nervous system meant spinal cord, but here it means bone marrow. A myeloblast means an immature bone marrow cell. Myelodysplasia. Plasia means production or formation. Myelo means bone marrow, and dys means difficult or abnormal. So myelodysplasia is actually a pre-leukemic condition where the cells look abnormal. Neutral means neutral, neither acid nor base. Neutropenia is deficiency or low levels of neutrophils. And those are the most numerous or the most populated of our white cells. Nucleo, like karyo, means nucleus. So polymorphonuclear is pertaining to a nucleus with many shapes, or a multi-lobe nucleus. Phago means to eat or swallow. A phagocyte is a cell that eats or swallows other cells and or debris. Poikilo means varied or irregular. Poikilocytosis is abnormal condition of varied or irregular shapes of the red blood cells. And this is referring to certain types of anemia, and we'll talk about those in a bit. Sidero means iron. Sideropenia is deficiency of iron. And sphero means globe or round. Spherocytosis is abnormal condition of a rounded red blood cell. So instead of having the biconcave disc shape, the red blood cells are round. Thrombo means clot. Thrombocytopenia is deficiency of cells that clot. The suffix apheresis means to carry away or remove. So plasmapheresis is removing the plasma. Leukapheresis is removing the white cells. And platelet pheresis is removing the clotting cells. You've had the suffix blast. It means immature or embryonic. A monoblast is an immature cell with one nucleus. The suffix cytosis means abnormal condition of cells. Usually it means an increase in the cell numbers. Macrocytosis is abnormal condition of cells where they're very large. Microcytosis is an abnormal condition of the red cells when they're really small. Anemia is one you already know. It means blood condition. Leukemia is blood condition of the white cells. I think gen is a new one. It's giving rise to or producing. Fibrinogen is the production of fibrin. And this is the basis of a clot. We've had globin, it means protein. Hemoglobin is protein of the blood. And immunoglobulin is protein that protects. And globulin also means protein. Lytic means pertaining to destruction. So thrombolytic therapy is therapy aimed at, or the purpose of this therapy is to destroy clots. Oid means derived from or originating. Myeloid means derived from the bone marrow. You've had osis, it means abnormal condition. Thrombosis is abnormal condition of the thrombocyte or the clotting cell. And penia means deficiency. You've had that one as well. So granulocytopenia is a deficiency of the granulocytes, so the basophils, eosinophils, and neutrophils. Pancytopenia is deficiency of all cells. Pan is a prefix that means all, and cyto means cells. Phage means to eat or swallow. A macrophage is a large cell that eats or swallows worn out red blood cells and other foreign materials. Philia means an attraction for or an increase in cell numbers, depending on how it's used. Eosinophilia will be an increase in the eosinophils. Neutrophilia will be an increase in neutrophils. Phoresis means carrying or transmission. Electrophoresis is carrying cells using electricity. And poiesis means formation. Hematopoiesis is the formation of blood. And erythropoiesis is the formation of erythrocytes or red blood cells. And myelopoiesis is the formation of bone marrow. You've had stasis, that means stop or control. So hemostasis will be to stop or control bleeding. The next page talks about some pathology. And I want to talk about the different types of anemia. Anemia is deficiency in erythrocytes or hemoglobin. And remember, hemoglobin is that molecule that attaches to erythrocytes, and we need hemoglobin in order to carry or transport oxygen. So the different types of anemia, and there's 5, I want you to mark these. And I'm going to tell you a real simple way of remembering them. So with aplastic anemia, this is failure of blood cell production in the bone marrow. So with aplastic anemia, the red cells just don't get made, which is why there's a deficiency in the red cells. They just don't get made. IC is pertaining to, A means without, and plaso means to form. So with aplastic anemia, I would just write next to that, don't get made. The second one is hemolytic anemia. Hemolytic anemia is reduction in red cells due to destruction. Hemolytic is destruction of blood. A lot of times this has to do with the shape of red cells that they're destroyed. So hemolytic, they are destroyed. They're made, but they're destroyed. Whereas aplastic anemia, they don't get formed. Number 3 is pernicious anemia. And this is lack of mature erythrocytes caused by the inability of the body to absorb vitamin B12. And vitamin B12 is necessary for the development and maturation of red blood cells. Although B12 is a common constituent of food, it cannot be absorbed in the bloodstream without the aid of a special substance called an intrinsic factor, which is usually found in the gastric juices. Sometimes as people age, that gastric juice doesn't get made, or it's decreased in such a way that they have pernicious anemia. The erythrocytes can't mature because of that lack of the intrinsic factor. So if somebody has pernicious anemia, they usually come in every month, and we give them an injection of vitamin B12 in the muscle, and that helps them with their red blood cell maturation. So aplastic, it doesn't get made. Hemolytic, it gets made, but it gets destroyed rapidly. And pernicious, there's no mature red cells because there's no B12 being absorbed. Number 4 is sickle cell anemia, and this is a hereditary disorder of abnormal hemoglobin producing sickle-shaped erythrocytes and then leading to hemolysis. And if you look up at the top of 518, they have a picture in the middle of normal red cells, and the bottom right has sickle cell. Crescent-shaped, distorted, and fragile on their way through the bloodstream. These get broken down pretty easily, so sickle cell is when they're shaped like sickles instead of their biconcave disc shape. Above that, the pernicious is a large immature megaloblast, so they can't mature. Number 5 is thalassemia, and that's also on the bottom left. This is another inherited disorder of abnormal hemoglobin production leading to hypochromia. And this is seen in Mediterranean or Asian background. And what the red cells look like under a microscope is very pale or pinkish in color. So mark those 5 different anemias. Hemophilia, that's a disorder of blood clotting. Mark that one. And that's excessive bleeding caused by hereditary lack of factors 8 and 9. And these factors are necessary for blood clotting. Page 520, mark leukemia. These are diseases of white cells. Leukemia is increase in cancerous white blood cells. If you look at the different types, number 1 is AML, or acute myeloid leukemia. This is when we have immature granulocytes predominate. Because these granulocytes take over, platelets and erythrocytes are diminished because of infiltration and replacement of bone marrow by large numbers of myeloblasts, so immature cells in the bone marrow. Number 2 is ALL, or acute lymphoid leukemia. This is caused by immature lymphocytes, and those are one of those 2 agranulocytic cells. This is most often seen in children and adolescents, and it's a sudden onset, and that's ALL. Number 3 is CML, or chronic myeloid leukemia. Both mature and immature granulocytes are present in large numbers in the marrow and the blood. This is a slow progressive illness, which patients often older than age 55 may live many years without encountering life-threatening problems. And then chronic lymphoid leukemia, or CLL, abnormal numbers of relatively mature lymphocytes predominate the marrow, lymph nodes, and spleen. This is the most common form of leukemia, occurs in the elderly, and again, like CML, it follows a slowly progressive course. It often does not require immediate treatment or any treatment as the patient ages. Okay, so those are the different types of leukemia. Page 522, I would like you to mark mononucleosis. And that's an infectious disease marked by an increased numbers of mononuclear leukocytes and enlarged cervical lymph nodes. Mononucleosis is caused by the Epstein-Barr virus. People have lymphadenitis, so inflammation of their lymph glands. And they also have fever, fatigue, asthenia or weakness, and sore throat or pharyngitis. Down at the bottom of 522 under lab tests, please mark CBC or complete blood count. Determination of numbers of blood cells, hemoglobin concentration, hematocrit, which is the hemoglobin in a percentage form, and red cell values. Page 523, mark hematocrit or HCT, percentage of erythrocytes in the blood. Hemoglobin, mark that one, total amount of hemoglobin in a sample of peripheral blood. And remember, hemoglobin is the chemical that allows red cells to transport oxygen. Mark prothrombin time or PT, and this is a test of the ability of blood to clot. Red blood cell count or RBC, number of red cells per cubic millimeter or millimeter cubed, or microliter. Sorry about that. Somebody turned on the TV downstairs. Okay, good. All right, red blood cell morphology is just that. Morphology is a study of shapes, so it's looking at the shapes of the red blood cells, more than likely to rule out different types of anemias. White blood cell count or WBC, number of leukocytes per cubic millimeter, millimeter cubed, or microliter of blood. And then a white blood cell count differential goes one step farther and tells us how many basophils, how many eosinophils, how many neutrophils, and how many monocytes and lymphocytes are present. 524, mark apheresis. And the apheresis is a word that we know means separation. So separation of blood into the component parts, and then we may take out erythrocytes, or we may take out plasma, or we may take out some clotting proteins. Whatever we're taking out, we're doing it by way of apheresis. A blood transfusion is whole blood, the cells and the plasma, or cells, which would be a packed cell where we take the plasma off of it, are taken from a donor and infused into a patient. And remember, types A, B, and O all have to be compatible with the blood they're receiving. So I'm type A, I can only receive from other type A and type O, and that's it. If you're type O, you can only receive from type O. If you're type AB, you can receive from everybody, okay? Bone marrow biopsy is microscopic examination of a core of bone marrow removed with a needle. We can discover many blood disorders such as anemia, pancytopenia, and leukemias by looking at that bone marrow tissue to see what's going on at the very beginning, or at the beginning stages of these blood cells. Hematopoietic stem cell transplantation. And this is when we take stem cells from a compatible donor, are administered to a recipient. Patients with malignancies such as AML, ALL, CLL, or CML, all those leukemias. Lymphoma and multiple myeloma are great candidates for a hematopoietic stem cell transplant. The healthy stem cells come in, and they hopefully will populate the body with healthy stem cells and eradicate that leukemia or other lymphoma that the patient had. Oftentimes what we'll do is before that, we'll put the patient in the hospital and we will deplete their blood count or their white counts that have taken over. So we'll deplete the white cells almost to nothing. So patients can have visitors, they're on restrictions. We don't want any type of infection because we're taking them down to the bare minimum before we give them this transplant. And it's a life-saving transplant. Picture on 525 of a bone marrow biopsy, very large bore needle into the iliac crest or the upper portion of the patient's hip bone, and aspiration of liquid bone marrow, and it's a little clump of tissue. And that's on 525. So let's go ahead and look at some practical applications. On 528, what I'm going to have you do is push pause, or if you don't want to push pause, you can just do this on your own and check your answers. But 528 has a really nice case study. It's number 1 is about a 65-year-old woman, 2 is a 22-year-old college student. So it's a good combination of different age patients and different illnesses. But it gives you their values, and the normal lab values are up on top there. So you can compare the patient's lab with the normal lab to make your choice for A, B, or C. So I'm going to have you push pause, and I'll wait here, and go ahead and do numbers 1 through 6 on page 528 and the top of page 529. Okay, hi, you're back. Number 1, what did you put for the 65-year-old woman who had shortness of breath and swollen ankles? I put C, pernicious anemia. And the clue in there was her vitamin B12 level was very low. So 1 is C. Number 2, the 22-year-old college student. B, acute myeloid leukemia or AML. Number 3, the 35-year-old woman who went in complaining of spots on her legs and bleeding gums. That would be autoimmune thrombocytopenic purpura. And number 5, what would the patient who is 55, who had a motorcycle crash and he had hemopneumothorax, so blood and air in the chest cavity. His hematocrit was 33.7. On the 3rd day, his hematocrit dropped down to 22.4. What did he need? Well, he needed red cells, so the best answer would be letter B, a transfusion of packed red blood cells. He doesn't need the plasma and all of the plasma proteins and the immunoglobulins. He just needs those red cells because he's losing blood. Number 5, the 45-year-old woman who had been traveling internationally. Which element of the differential do you expect to see elevated? It would be eosinophils. Letter A. So the case report, 4-year-old Sally has been running a low-grade fever for several weeks, recurrent sore throat, earache, and cough. Her mother takes her to the family physician who diagnoses her condition as otitis, which is ear infection. She continues to be fatigued and anorexic, which means she's tired and does not want to eat. Her mother then notices bruising on her legs and arms. The family physician orders blood tests and an antibiotic drug. Peripheral blood test reveals a hemoglobin of 7.4, platelet count 40,000, and white blood cell count 85,000 with 90% lymphoblasts or immature lymphocytes. A bone marrow biopsy was ordered. The most likely diagnosis for Sally would be letter C, in the ALL, acute lymphocytic leukemia. That's most common in children. The probable cause of Sally's ecchymoses, or those bruising on her arms and legs, is thrombocytopenia. The white or the platelets or the clotting cells are being pushed out by the high number of white cells or the lymphocytes. The likely explanation for her fatigue is same concept. The white cells are hogging all the space in the bloodstream. They're kicking everything else out, so lack of red blood cells. So anemia. Number 3 would be A. And treatment for Sally's condition, how do we treat leukemia? It is chemotherapy, using chemicals to treat. Very good. All right, in your on Schoology, and maybe you already saw it, that I have a link for you to click onto, and it takes you to the American Red Cross, and it takes you to learning about blood. And the thing that I think was really interesting was the blood typing. And it tells you, if you have this type of blood, who can you donate to? And then on the other side, if you look on the right side, if you have type A blood, who can you receive from? And whatever arrows are pointed to A is who they can receive from. And there are a whole lot of information on this website. So I would encourage you to explore it and to learn some new things about blood cells. All right, that'll do it for this unit. We'll see you next week for chapter 14, which is lymph and immune. If you have any questions or concerns, feel free to email me, text me, or call me. And I hope things are going well. Thank you.